Dr. Stephen May, and I'm the Regional Medical Director here at Sullivan County Regional Health Department. And we thought we'd take a few minutes and talk a little bit about COVID-19, the new novel coronavirus. Just a little bit of history. The novel, meaning new, coronavirus began in China around December. Rapidly has spread now across the world, and we're now seeing cases in almost every country across the world. At first it was associated with international travel, but many of these countries are now seeing community spread throughout their populations. So this is a coronavirus. We've had a number of coronaviruses for years. They generally cause just cold and congestion, usually among our kids. And then we've had two bad types of coronaviruses. One of those is called MERS-CoV, which was isolated, contained, and has disappeared. We also had the SARS a number of years ago. It was a coronavirus. It caused a lot more mortality, but it wasn't as infectious. This new one appears to be highly infectious, easily spread, and has an increased mortality over the flu virus by about a factor of 10. Flu virus kills about 0.1% of the population, and mortality here is disproportionate. Overall, it's 1 to 3%, but we see the largest portion of our deaths in those who are elderly and with comorbid conditions. So what are the symptoms that we typically see with this type of COVID-19 infection? Typically we'll see moderate fever, cough, and shortness of breath out of proportion to the normal that you would get with, say, a mild cold or chest congestion. In younger folks, it tends to be short-lived, and 80% of people recover without needing any type of medical care at all. Up to 15% of patients will need to seek some type of health care, and 5% will become severely ill. And in those severely ill group is where we see the bulk of our deaths. We know that after the age of 60, the death rate goes up, and those with comorbid conditions or those who are immunocompromised, so such as with heart disease, lung disease, diabetes, cancer chemotherapy, on biologics, are also at increased risk. So how do we know that you've got COVID-19? Right now, we're in an isolation and containment strategy or mode at this time. We are not seeing community-wide spread at this time. We do have testing that is coming online and is becoming much more available every day. This can be done through the Tennessee Department of Health, but we're screening primarily those who we feel to be high risk. Such as those who have traveled to a country where we've got known COVID-19 infection, or they've had contact to an existing case that we know about of COVID-19. LabCorp and other laboratories are now coming online, and we hope to have widespread testing available in the oncoming weeks. So you get COVID-19, how do we treat it? Right now, the treatment is only supportive care. We do not have a vaccine. We do not have any antivirals like we have for flu. So we treat people with general support. So if you have mild symptoms, we treat it just like we do a cold or any other respiratory infection. However, as you become sicker, that level of support can escalate to whatever the need may be, such as oxygen, IV fluids, possibly having to go onto a ventilator for ventilator support. So without a lot of great, fantastic, effective treatment, we have to look at how do we prevent people from becoming infected. And these are basic public health practices we should be practicing every day during especially the cough, cold, congestion, and flu season. But we've become rather lax, so we need to step up our known practice of just basic public health. So respiratory etiquette. Cover a cough, so cough into your sleeve, not into your hand. Use a tissue to blow your nose and then discard the tissue. Washing your hands is the most critical, important thing you can do. Washing them often and keeping them clean. Washing your hands before you touch your face. We as human beings tend to touch our face hundreds of times a day, and it's our habit. And we've got to learn not to touch our eyes, nose, or inoculate our mouths. So keeping our hands away from our face, and if you do touch your face, be sure those hands are washed. The other concept is social distancing, and when we talk about social distancing, there's a couple of different areas we talk about there. One is learning to keep 6 feet away from each other, because droplets are the primary route of spread of this illness. And when you cough or sneeze, those droplets typically don't go any farther than about 6 feet. So if somebody's coughing, hacking, snorting, and snooting, stay 6 feet away from them. The other is, if you're ill, we need you to stay home. You don't need to be sharing this with your friends, with the people that you work with, your co-workers, and more importantly, we do not need to share this with the elderly and those at increased risk of complications from this type of illness. We must protect those at the highest risk. A common question we get is, do masks make a difference? Masks do not really make a difference. If someone is ill, we put a surgical mask on them to catch those droplets. But just wearing a regular surgical mask really doesn't make much difference otherwise, unless that person is ill. Healthcare workers use a very specialized kind of mask called an N95 mask, meaning it filters out 95% of viral particles. But it has to have a special fit, and you have to be tested for it. And if it doesn't fit right, it really doesn't do anything for you as far as protection. And coming back to washing our hands, appropriate respiratory etiquette, social distancing. Now, as we see this disease progress further through the community, and when and if we get community-wide spread, then you'll see more aggressive methods of social distancing become active, such as limiting large crowds, looking then at the possibility of closing schools, areas of high congregate mass, might be considered if that becomes an issue. It's important that we slow the spread of this disease. We may not be able to stop it, but at least we need to slow the spread so that we can stretch our resources and ensure that we have the resources that we need, and not have a big spike where we utilize all our resources at once, but we need to do this gradually over time. So this is why isolation and containment becomes important. This is why we need to practice those good public health practices that we should have been doing all along, such as respiratory etiquette, washing, social distancing. It becomes even more important now so we can slow the spread of this disease. Good places to find information. And I would encourage you to look for reputable places of information, because the internet has a lot of misinformation that's going out. The latest information can be found at www.cdc.gov. They have almost daily updates and frequently asked questions that's very easy to access and go to. Also, you can go to our Tennessee Department of Health website, tn.gov/health, and there's a big gold banner there. Just click on that. It says for coronavirus infections or COVID-19. And they have the latest information there. Latest case counts are being posted by the Tennessee Department of Health by county, and that is also on that website. Other information can be found at our website, www.sullivanhealth.org, and we try to keep updated information and links on that website. Of course, you are welcome to call our health department, 423-279-27777. Currently, we're operating a phone answering tree that will be able to help work through most of your common questions. And the Tennessee Department of Health also has a clinicians hotline that they are operating to help assist clinicians work through this diagnosis and if there is a true need for testing.